Okay, good morning, everyone. Good afternoon or good evening, depending on wherever you are in the time zones of the network. So welcome and thank you for being here. And again, thanks to the organizing committee, both at the central U21 and the local organizing committee for organizing this this session, but also the meeting. As mentioned yesterday, the virtual conference adds a different level of complexity to the meeting. So congratulations and thank you very much. Okay, yesterday we had a very interesting presentation from Darina, and discussion after, and I hope today we have an interesting one. Today, the idea is to discuss some experiences in education in dentistry and changes due to the pandemic. And I will pass to Professor Jorge Martinez, who was the promoter of this initiative, to chair the session. Thank you.
Oh, thank you, Rodrigo. Again, I will also want to say thanks to the organizing committee for making this meeting possible. And also I want to thank Dr. Rodrigo Marino, our chair of dentistry group, who invited me to participate in moderating this session. As Dr. Rodrigo said, the idea for this meeting was to share experiences in how our universities faced this pandemic era, and how our teachers live this, how our students live this, how did we have to modify our way of treating patients, how all the protocols had to change. And we thought that sharing our experiences could be something interesting for the rest of the group, so we could learn and share what could probably help us to overcome those situations. And also those things that probably didn't work, and some mistakes that probably happened, from which we learn also. And for this session, we had some pre-recorded tapes, one from the Pontificia Universidad Católica de Chile, another from Tec de Monterrey, and another one from University of Melbourne. And the idea is to listen to these presentations in video, to sharing experiences, and then start a discussion. If you want to post some questions or aspects we will discuss later, you can go ahead, or just wait until we've finished and start a discussion. So if the committee could help us to start with the first video, please do.
Quiero aprovechar esta oportunidad para saludar a toda la comunidad del U21. Esta pandemia ha impactado en nuestras vidas de manera muy importante, y en ese sentido también ha afectado nuestro trabajo y nuestra actividad formativa de los alumnos. Vimos forzados a responder en plena pandemia, a cambiar nuestras rutinas de enseñanza y a modificar nuestras prácticas de docencia en serias dificultades, sabiendo muy poco de cómo manejar este virus y cómo controlar esta enfermedad. Nuestros equipos docentes se vieron fuertemente comprometidos, ¿no es cierto?, pero esto también abrió un espacio para la creatividad, para innovar. Fue así como docentes, funcionarios y estudiantes se pudieron unir para salir adelante en plena pandemia y así entregar todo lo que necesitábamos a nuestra comunidad.
Mi nombre es Ginia Carachi, soy alumna de sexto año de odontología y el día de hoy les voy a contar un poquito de cómo fue mi experiencia en pandemia. Yo creo que la pandemia de este año nos hizo plantearnos el qué estábamos haciendo, qué vamos a hacer ahora y también el qué se viene para el futuro. Y yo creo que en ese sentido la universidad logró dar respuesta a las demandas que nosotros teníamos en ese momento. Pasamos por hartos periodos, primero un periodo que fue totalmente online cuando estuvimos en cuarentena y después de eso fuimos una de las primeras carreras que pudo volver al campus San Joaquín. Ahí fue una experiencia súper buena, logramos al fin volver a atender pacientes y poder seguir relacionándonos un poco más con la experiencia clínica, que igual durante el año tuvimos una parte teórica, vimos casos clínicos y todo lo que fuera posible para poder suplir un poco esa falta de pacientes que teníamos en ese momento por el contexto sanitario.
La última parte ya del año 2020 pudimos ingresar nuevamente a la universidad con una serie de protocolos bastante estrictos y rigurosos en cumplimiento a la normativa sanitaria en el contexto de la pandemia, y eso nos permitió entonces iniciar actividades clínicas en, ¿no es cierto?, los programas que habían iniciado sus actividades teóricas de manera sincrónica online en marzo del 2020 y así poder entonces dar una continuidad tanto en los tratamientos como en el logro de los resultados de aprendizaje de nuestros 5 programas de especialización. Ellos se han ido manteniendo durante el año 2021 y afortunadamente, como hemos tenido condiciones sanitarias que hoy día se han mantenido en un contexto bastante mejor que lo que teníamos hasta el año anterior, hemos podido incrementar la actividad clínica en CODUC, siempre manteniendo estos protocolos sanitarios y que han ido permitiendo que nuestros estudiantes en el área de posgrado puedan ir cumpliendo con los, ¿no es cierto?, programas de cada curso y además también con el logro de los resultados de aprendizaje que se espera que ellos adquieran en el manejo de las competencias clínicas, ¿no es cierto?, comunicacionales, éticas, ¿no es cierto?, y el profesionalismo importante que es parte de la formación de nuestra universidad.
Durante esta pandemia hemos apoyado a nuestros alumnos con aparatos electrónicos para su conectividad como préstamo de tablet y además becas de mantención para que puedan mantener su conectividad a clases. Además los hemos estado apoyando vía online, entrevistas por Zoom para cualquier tipo de orientación, postulación a beneficios de la universidad y orientación a los beneficios que le otorga el Estado.
Efectuamos talleres en grupos pequeños, los cuales favorecen ambientes de confianza para lograr un verdadero aprendizaje significativo, reforzando el sentido de pertenencia y también identificando los estudiantes que necesitan más apoyo o contención. Nosotros hemos centrado el aprendizaje en el estudiante, en donde nosotros no solo cumplimos un rol facilitador, sino que los acompañamos en su proceso de enseñanza-aprendizaje en un tiempo que es de crisis.
El gran desafío en la educación continua para nosotros fue la transformación digital, la adopción de metodologías de enseñanza-aprendizaje que nos permitieran mantener los programas activos a pesar de la distancia, y pudimos incluso mandar materiales a los estudiantes a sus casas para que pudieran realizar actividades prácticas.
Crear nuevos protocolos de atención en atención a esta situación pandémica, hacer modificaciones estructurales en términos de separación de los espacios físicos, readecuación de la climatización, de las ventilaciones, con el fin de cumplir con todas las exigencias de la autoridad sanitaria. En este momento la clínica se encuentra preparada para realizar su atención cumpliendo con todas las normativas que establece la autoridad, lo cual ha significado, como decía hace un rato, una intervención importante y en estructura, modificar algunos espacios, cambiar el sistema de ventilación. Todos todos esos procedimientos como para cumplir con las exigencias de la autoridad sanitaria.
También durante la pandemia fue una oportunidad para hacer procedimientos de acción y seguridad que incluyen los procedimientos operativos estándar que hacemos dentro de los laboratorios, así como las medidas de prevención, trazabilidad y tamizaje para el retorno seguro al trabajo experimental. Hicimos también actividades teóricas, entre ellas un ciclo de webinars en los cuales, en conjunto con el grupo de ontología de la U21, difundimos conocimientos a través de este ciclo de webinar en el que participaron los doctores Rodrigo Mariño y Jorge Martínez, quienes compartieron con nosotros y con nuestros estudiantes sus experiencias en investigación y en la clínica. También un grupo de profesores, de 4 profesores de nuestra Escuela de Odontología UC, hacemos parte de la directiva de la International Association for Dental Research División Chile, y por primera vez en la historia de nuestra división nosotros organizamos las reuniones anuales en formato virtual. Finalmente quiero comentarles también que un miembro, un profesor de nuestra escuela, también participó activamente en la elaboración de la guía de práctica clínica para minimizar el riesgo de transmisión del SARS-CoV-2 durante la atención odontológica generadora de aerosoles del Ministerio de Salud de Chile. Parte de nuestra escuela también ha participado en este compromiso de salud pública que tenemos con la sociedad.
Sin duda alguna, la pandemia por COVID-19 nos presentó un gran desafío para nosotros como Escuela de Odontología. La adaptación de la educación a formatos remotos nos llevó a encontrar nuevas oportunidades para entregar los contenidos a los estudiantes. Una dificultad que pudimos superar fue la conectividad y el acceso a equipos de los alumnos. La universidad y la Escuela de Odontología pudieron ayudar a través de préstamos de computadores y tablets, así como becas de datos móviles. Si bien muchas de las actividades son difíciles de realizar a distancia por las características particulares de la carrera, encontramos nuevas metodologías que resultaron exitosas y que probablemente llegaron para quedarse. Las diferentes áreas de nuestra escuela se vieron desafiadas a innovar y finalmente hemos podido seguir adelante con todas nuestras actividades.
Hello, my name is Ernesto Ramos. I am a dentist with a master's degree in advanced dentistry, and I am the director of the DDM program at Tecnológico de Monterrey. Since 2019, COVID has represented a big challenge for the humanity in different aspects. Dentistry was not excluded. Authorities in this field changed and modified guidelines for the attention of dental emergencies, but the biggest challenge came in dental education of graduate and undergraduate students. When the pandemic started, the effect of it reached Mexico in March 2020. That was when the Dean of Tecnológico de Monterrey decided to close campus and move everything to online education. There were some institutional adaptations and some others improvements with clinical practice such as dentistry. The adaptations we made were in 3 different aspects: online education of theory and clinical courses, infrastructure and protocols in order to come back to clinic when possible, and follow-up of the well-being of teachers and students. From March to June of 2020, the courses were completely online. The purpose of clinical courses was to encourage the students to discuss with their professors the diagnosis, techniques, treatment plan, and materials used in different cases in order to develop their critical thinking in clinical cases. Now I will show you the changes we made in the infrastructure of the clinic and in the protocols of biosecurity as well, in order to receive the students to continue with their clinical practice on the semester of August 2020.
Let's take a view of the clinic, which is called CAT, that stands for Academic Center for Dental Attention. This is where the students do all the clinical practice. The back door is exclusively for faculty members and students. A filter was installed in order to record the temperature and to ask questions to detect any symptom. There is also a space to put on the personal protective equipment. It is important to say that all the equipment had been used before the pandemic, but the use of double mask was added, a KN95 first and a surgical mask over it. In the waiting room, the distance between chairs was increased, and the patients answered a questionnaire about symptoms related to COVID-19 and put on a disposable medical gown, cap, and shoes to get into the clinic. Inside the clinic, the height of the glass divisions between dental units was increased in order to avoid the spread of sprays. In the air conditioner, filters were installed to clean up the air from particulates, and the system was changed to promote the recombination of air from outside the clinic to reduce the concentration of fine particles. These measurements allowed the students to come back to clinic, but let's hear a student's perspective of dental education during pandemic.
Hi, I'm Ariana. I'm an intern and I am doing my social service at CAT. I was in 8th semester when the pandemic started. In my school, the semester starts in February and the pandemic started in March. So one day to another, we needed to suspend everything. And my school adapted everything online. So we were having every class and every clinic online, which meant that we still had some clinical cases, but we learned by experience. We learned by experience our own doctors had, and we were learning by that. On my 9th semester, I was supposed to have my international rotation, but because of the pandemic, I wasn't able to travel. But we were lucky to be going to the clinic and to take advantage of all the clinic that we didn't have in the last semester and to implement all the knowledge we had online to implement it now us on our patients, on our own practice. So at the beginning, us coming back to the clinic obviously was a little scary, but seeing all the different things that were, all the changes that our school has made to the clinic felt us feel secure. My school did some modifications in order to us to be coming back to the clinic in different aspects. And the first thing they did, it was to reduce the capacity allowed in the clinic. We changed from having a 100% capacity to a 30% capacity. And also infrastructure, the different units we had at the clinic had to have another height for not to have communications to other spaces. So unlike other universities, I really felt blessed to be able to develop my own clinical skills by my own and not by other experience that even though it is really good to have other experiences, it's not the same as to you develop by yourself. So I'm really grateful about the opportunity that we have in my own university to be able to come and to finish my career without losing any opportunity for me to develop my own skills.
I'm Dr. Anu Polster. I'm from the Melbourne Dental School at the University of Melbourne. My topic for today is real to virtual to real. So let's begin. At the Melbourne Dental School, I'm the coordinator of the first year Doctor of Dental Surgery program. I'm also the subject coordinator for what is known as operative dentistry, clinical simulation for the first years. So let's have a look at how we used to teach and how we changed or taught differently as a result of the COVID pandemic. So traditionally, we have a lecture, which is a face-to-face lecture, which didn't really give a lot of time for question and answers. After about a 45-minute lecture, you have about 5 to 10 minutes for question and answers. Students would then adjourn to the clinical simulation lab or a preclinical laboratory, where we would then run a demonstration video during the practical class, and then the students perform their set task for the session. And how did things change as a result of the COVID pandemic? So we had to very quickly get lectures delivered online. I did lectures as a PDF, which was uploaded, and then I did one with a voiceover explaining these slides on that, on the PowerPoint. And that was followed by a demonstration video, which we actually pre-recorded. Again, I kind of like doing one with the voiceover and one without the voiceover. This was then uploaded to the learning environment and was up to about 10 days prior to the preclinical session. So students were able to view this prior to both the preclinical simulation as well as the question and answer session. We had a dedicated 1-hour question and answer session, and we had 15 of those throughout the year. It really worked quite well. And after that, and that would be about a week between viewing the demonstration video, question and answer, before adjourning to coming into the clinical simulation laboratory. And therefore, we did not have to run the demonstration or the video during the practical class, which gave the students an extra hour, because that's how long it took for me to explain the demonstration video, to actually do a lot of other tasks or extra tasks. So a traditional delivery of a lecture, you had approximately 10 minutes, maybe 5 minutes at the end of the session. In terms of the lectures itself, I had quite a good attendance. I usually had about 90% of the students attending my lectures. But again, sitting there with a laptop and typing away, you don't particularly know what they were doing. They could be on social media, they could be doing online shopping. So there were distractions, even though they had the laptop and they were taking apparently notes. Lectures delivered online, we uploaded this about a week before the lecture was actually required, or timetabled within the timetable. And this was uploaded to the learning environment. It was, doing this for the first time, it was a bit frustrating because the reliance on internet was quite heavy and it was time consuming. Again, I had a look at the participation on who was viewing these lectures, and as you can see, you can do that. Again, there was quite a lot of students viewing these lectures online, and I could see that. Now, whether they were doing something else, whether they were cooking while they were doing social media, whether they were doing online shopping while viewing the lectures, we don't know. Now, the demonstration videos in the past, we used to actually play during the practical class, and that would take up to an hour of the video playing for each practical class. Now, we have about 100 students, and the venue only takes up to about 40 students to 50. So we end up dividing the class into 3 groups, which means I will have to repeat this video 3 times, and I'll have to explain the video 3 times. And you need to be consistent 3 times, and it's quite tricky. Inevitably, there will be inconsistencies within the explanations if you do it 3 times. One of the advantages of running the demonstration videos during a practical class is the demonstrators who supervise the students actually get to view it, and so they know what's required for that session. As a result of the whole COVID pandemic, again, we ended up pre-recording the videos. Again, like I said, I do one with the voice over and one without. We get to upload it into the learning environment 10 days ahead of the practical class. It just meant that students had 10 days to view, to review, and to revisit these videos several times if they wanted to, and which they did. And that also saved the 1 hour of viewing that video during the practical class, which meant the students actually had an extra hour to practice more tasks during their preclinical simulation classes or sessions. The demonstrators were provided access to the learning environment, but they could only view this at their own time, and that's if they had the time. So that could it be a disadvantage or could be an advantage? The way I did these demonstration videos is very simply, I updated and edited them with whatever apps I had on my laptop. Like I said, we went into a snap lockdown, and it was whatever apps that I had on my laptop, which is a Mac. So I edited it with Keynote without a voiceover, the videos, and then I used Capture to re-record the demonstration videos with the voiceover. I used Capture because it kept the resolution of the video, so we didn't lose that high quality. And then VLC to reduce the size, so it was just easier to upload into the learning environment. The question and answer sessions were almost non-existent in the old days with the lectures. For several reasons, we only had 5 to 10 minutes, but it was also tricky for students to understand, assimilate that lecture, and then have to query or have questions, within that 45 minutes. So I think what really worked with the question and answer sessions, as a result again of the pandemic, was we had 1 hour Q&A sessions. And this was after they had viewed their lectures and after they had viewed their videos, and they could have viewed it several times and therefore wrote down their questions and queries. The attendance for my Q&A sessions was 90%, incredible amount of engagement in that they asked a lot of questions. They sent the questions in advance via email to me, or they would type their questions in the chat of Zoom, or they would actually just verbally shout out their question or query so that I could answer them or respond to it. My preparation for these Q&A sessions was, again, I kept it very simple. It was my Mac laptop. I had an iPad connected, and I used it with PowerPoint and QuickTime. And I also had a little portable document camera, which I purchased on my own. I used Zoom, as many of us do, to record the Q&A session. And the iPad, the PowerPoint, and QuickTime is for me to draw my diagrams, as you will see in a minute. The recorded session was just immediately uploaded to the learning environment at the end of that Q&A session. So let's look at one of my Q&A sessions that I have. And it would start off with a Word document, which I will add my questions to. This is the learning environment that we have, and it's where I upload all my lectures, and you can see such as that's a lecture with a voice over, and then you've got a Q&A session, and we've got the videos with and without the voice over. So that would what it would look like, and it's very sequential. It's labeled 1, 1A, 1B, 2, 2A, 2B. This is a diagram that I would draw on my iPad, and that would project onto my laptop. And this is what we did for diagrams if they needed clarification. And this is at the 28-minute mark, and you can see we've had 13 questions for this particular Q&A session. The way I kept track of the questions that I answered is I would highlight it in yellow once I've answered that question. That was one way of me keeping track, as well as students knowing which questions I've actually answered. And then we get to about 56 minutes, and you can see that we've had 23 questions, and we kept going. So it was very engaging. It was very good questions. And when I say good questions, we're doing pre-clinics, and these questions were really clinical application questions. So they were really thinking of how they could apply these tasks in a real patient. So I found this very, very, very stimulating, and I hope the students found it, and I think the students found the same as well. Next we have, my bad. Next we have what I did was my portable document camera. And here we were doing this together. So I got every student to take home a Toffler-Meyer matrix band. And we put this together on a lower 4/6 and an upper 1/6. And so we did this together. So just having a look at tooth 1/6. And at this point, we placed how do you burnish the matrix band for contact, and placement of the wedge. So it's not perfect, but it showed what needed to get across. And we did this together, and students now have this. It's only about 13 minutes in total, and they could view it and practice this at home prior to coming into the class to apply the ortoflamide band and retainer. So what worked? I think for me, it was keeping it simple. It was what are the applications that I had on my laptop and what hardware I could use to do what I could do. I had all my content, as I shown you earlier, uploaded in the one area, the one module. At the university, you could upload your lectures in a different area and your videos in another module, but I chose to keep it all in the one area. The feedback from the students, they really appreciated it. They could see the sequencing of the way the lectures and the demonstrations went. I did enjoy the Q&A sessions because it gave the students an opportunity and gave me an opportunity to explain, re-explain, clarify, and re-clarify any queries, any questions that the students had, going back even as far as the first lecture or the first video. And I think we underestimate how content heavy and how different dentistry is. And it does take some time to understand these terminology and principles. We, as a result of pre-recording lectures and videos, we're able to upload the content up to 10 days in advance, which I think is, like I said, students really appreciated that because they could review and review these and the lectures and videos. Again, as a result of uploading your videos, we had an extra hour in the pre-clinics because I did not have to go through that demonstration during class. Q&A sessions are thoroughly engaging, very stimulating for both myself and the students, and consistently had about 90%, well, at least by Zoom, had 90% students participating or attending it. I was a bit of a big brother initially. I kept a tag on who was viewing my lectures and videos, just to nudge them along to say, you know, you really have to be watching this, but there were just very few who were not doing it. And when they caught on, they were back on track again. What would I change? What I did was really on the fly. It was a snap lockdown. We had to get things done. Could have been done a lot more eloquently and a bit more professionally. So a bit of added support would have been nice. So going forward, that would be nice to get some more professional lectures and videos done. Adding timestamps to the videos. Not everyone's keen on long videos. I am. I like to see the whole sequence of, you know, like a whole video starting from dental dam isolation to cavity preparation to restoring a cavity, polishing and removing the dental dam. So if I'm going to have a long video uploaded, it would be nice to have timestamps. And that would, I suppose, I prefer that to dividing that video into smaller videos, if that makes sense. Something I'd really like to explore is adding quizzes. So if there's anyone here that's got more experience in adding quizzes, that would be great to come on board and assist. I'd be happy to collaborate and do something together. But the quizzes have to be added on with students having something to learn. So not just adding the quiz for the sake of adding a quiz, but getting something out of it, both from the students and from me, that I know that students are learning something. Adding captions to videos, and you say why. I think there's a lot of new terminology in dentistry, example, toflamide. So just seeing the spelling of toflamide is something that you probably the students will relate to and learn better. Now with auto captioning, it's a lot easier, and you can just go and edit the words, a few different words that need to be edited. It would be great to have a strong Wi-Fi all the time. If you're like me and you have a family and you've got 4 people competing for Wi-Fi access, it gets a bit tricky. But it's all we can do, so you work with what you have. So just an example of a demonstration video here, and I've sort of tried to add some timestamps. You're looking at the application of a dental dam and preparation of a cavity prepper. And here you have the measurements of my cavity preparation that you're doing. the liner that you're going to be placing. So just looking at how to mix it, what it is. And then we're using the adhesive system that we use, again, going through a few details, the difference between the primer, the bond, and their functions. Again, maybe a little quiz in here. And material in this case for polishing a resin composite. And we finish off with a removal of the dental dam. All right. So, so that's, for me, works with the timestamps, I hope. And so that's something I'll be looking at. So where to from here? Questions do we need to ask? Did I just turn synchronous and asynchronous educational information into an electronic format? I don't think so. I think there was, even though we had to do it in quite a short period of time, I think a lot of thought was gone into it, sequencing, the length of these videos, the format of the videos and lectures, to keep it simple and for students to get the most out of it. I suppose then we really need some data and evidence to show that this actually works. Not for online training to replace traditional teaching, but really online training to supplement traditional teaching. And I think it can do this, and actually it can replace certain aspects of traditional teaching quite well. So I'm quite happy if there's anyone out there. I think we now need the evidence that what we do actually works. So I'm happy to collaborate, happy to work with anyone that is looking at similar ideas as I am. So again, thank you so much for the opportunity to present, and I look forward to viewing other people's presentation and perhaps looking forward to work together as well. Thank you so much.
Well, thank you very much to everybody that was involved in these videos. I know that everybody has a lot of work, and this is something besides what we usually do. Unfortunately, we couldn't have the actual live participation of PUC right now, but we did have the video and the explanation how they faced all this pandemic situation in their school. But what I could, just to begin with the discussion, what I did see is in PUC and also in text video, we didn't go too deep into what kind of problems, and this question is to Dr. Ernesto, what kind of problems did you face, or what did not work the way you planned in all these changes in adapting to the pandemic?
Well, well, at the beginning, when we moved to online education, everything to online education from one day to another, I think at the beginning it was very exciting, like moving or what we were doing to and trying to adapt our lectures to that format. And I think that maybe during the first semester, or at least maybe the first 3 months, maybe we oversaturate the students with online events. And since all the symposiums moved to that format, not only the academic activities, but also the other kind of activities, maybe we oversaturate the students, and we try to move our lectures. Maybe if we had 1 hour of lecture in the regular format, maybe we try to adapt it to 1 hour of online education. Instead of making this kind of adaptations, maybe shorten the lectures, maybe promote the participation of the students, and trying to develop another skills with this online teaching. Maybe that was the thing that at the beginning failed, but more than seeing that as a failure, I'd rather see that as maybe as something that we learn with this with the pandemic.
All right, thank you, Ernesto. Actually, that was one of the problems that we noticed, and when we switched to online sessions, after probably 1-2 weeks, we noticed that we were having an overload in classes for our students. And in that way of thinking, Rodrigo, how did you overcome students' interest in class and achieve active participation during Zoom sessions? I saw that you have a lot of pre-recorded sessions and lectures and some PowerPoint and something with a format with some pre-recorded explanation and all that. How did you involve and achieve actual active participation of your students?
Look, well, thanks for the question. I think, well, I mean, let me clarify something. This last year, the university has changed the learning management system. So we start the year with a new one that we didn't know, and then in March, well, the year starts end of January, early February, usually. So we start with a new system, and in end of March, mid-March, we were told you have to change everything to online. So we didn't have the enough experience with the learning LMS, the learning management system, when we have to start using its or try to use its full capacity, and we were discovering things as we advance. My experience with the student participation was mixed. Sometimes was very good, and actually I could achieve more participation than a normal well, face-to-face lecture. But in others, it was just very difficult to engage the students. And the other thing is that here in the University of Melbourne, class attendance is not mandatory. Labs and seminars are mandatory, but class attendance is not mandatory. So sometimes you have, as Anu said, 90%, which I would say is pretty good. But sometimes you get on 60 or 50 or even less percentage of presence during the actual lecture. And this is because lectures are recorded, so we hope that the students see that later. So there was this element that there was something new for all of us, and we try just to catch up with technology, because it was the first experience, and for the student was the same. It was a new system for them. And I can say that, I mean, we use a system called Canvas, which is very powerful. And I don't think we even use, I don't know, maybe 20-30% of the thing that you could do with that system. So yeah, that's the thing. I mean, we were caught in that we have to do something, and probably we didn't use the best way to do it, and we didn't use all the capabilities of the system. But I would like to highlight two things from that. One is that the technology was there, existed, and from the experience that we saw, each school managed to, I mean, from one day to the next, move everything to online, which demonstrate a very high capacity, flexibility, and capacity of adaptation. So in a way, the pandemic forced us to do something that was already there, but we didn't grasp. So that was good. And on the other thing is what you mentioned, or no, was Ernesto, the overload of information. I mean, it's just, I mean, I could be all day watching webinars, all day and night actually. It's just too much. Everything is available now, and I don't know how we can manage that or critically appraise which is what you want to watch or participate.
All right, thank you. Actually, we have here 2 interns from our school, Paula and Ariana. So I would like to ask you about this same topic. Paula, what would you change? What aspects you didn't like about your classes through Zoom? What would you rather do differently?
Hi, good morning. Well, from Mexico. I think the same as Dr. Ernesto said. When the pandemic started, I was feeling like overstressed, because we were having a lot of things, a lot of like Zoom meetings, and then like I felt that we were trying to do everything that we were doing in our normal life, and we were like saturated. That was the main thing that I like remember. But when we came back to the clinic, and when we started, and when the doctors were like, okay, this is our reality, we are going to fight for you and with you by your side, I think that we felt we were home again. And that's was over everything we passed. And now I think that Ariana and me and all my friends or my colleagues now, we feel very blessed, as also Ariana said. We had the best experience, because I now feel like I have experienced everything. I'm prepared for a pandemic, I'm prepared for a normal life, and I know that I have to deal with this my whole life and my whole career. So now I feel like I'm capable of everything.
Thank you, Paula. Thanks for your words. Ariana, what about you? What would you recommend to your teachers? We are still in pandemic. Of course, we actually are having live class right now. We have a mixture, and we still have some Zoom sessions. But what would you recommend to teachers like the ones we're here to better have these sessions, to better take advantage, to have more participation from students? What do you think about that?
I really think we have, I mean, at least in our classes, we do have participation, but I think that it can get better if, I don't know, if maybe to do something like while having the class, also do an activity like, I don't know, at that distance, like have the material at
like a hands-on activity.
Yeah, I think that would be good. But I mean, talking about only theoretic classes, I think we were really good at it because there was a participation, classmates giving the class, and the doctor giving feedback about the topic being exposed. So I think it was really great. I will only change that maybe in some topics because it doesn't apply to everything, but in some topics that maybe it would be better to practice, I don't know, a preparation at the prosthetic classes, etc.
Thank you. Thank you. So this is all about classes, but we heard that all of us in our universities, we have in common that we modify our facilities, our clinical facilities. We need to adapt them to have a regular treatment in a different environment. So that's the facility, the clinical facility. But what about people? Rodrigo, did you experience any hesitation from teachers to coming back to the clinic? And I don't know, Darina, if you're in a teaching environment or in a clinical environment, but I would like to hear about your experiences in people regarding not wanting to come back or to being afraid of getting the COVID-19. What about that?
Darina, do you want to start?
You can start first if you like.
Yep. Oh, okay. Well, we have here, well, there are a few things here about, look, I don't know exactly the proportion, but we have a high proportion, well, not high, but a large proportion of students from overseas. Maybe 20–30% of the students are overseas. So some of them went back. We have a large contingent from Canada. So some of them went back because, well, it was cheaper. And because everything goes online, I mean, this time was not a problem. But when the clinics reopened, there was a problem because they needed to get permission to re-enter the country, and some of them couldn't do it. So that was a limitation. The other thing, well, I didn't hear anything else from the student that they didn't want to participate, but there was a large reaccommodation of spaces, and clinics of, I don't know, 25 chairs were reduced to 10 because of the distancing. So there was a reduction of space that forced to have more than or additional sessions or shift to cover for that. The other thing was that we work in what is called a dental hospital. That's well, it's the dental hospital. It doesn't have bed, so patients don't stay overnight there. But in the past it did, but not now. And at the beginning of the pandemic, hospitals were a place where you were more exposed, more at risk of the disease. So patients were more reluctant to go. So you didn't have the same amount of patient coming to that. But I didn't hear anything from a student that they were afraid to go back. There still are very strict measure of well, measure. I mean, for protection of the using PPE and checks a stage at a different stage. There are checkpoints, and so I think I mean the students feel I think they felt protected. The other thing we did was that we moved. We have had several waves of lockdown here. So it's open, close, open, close. So at some stage, when we knew that it was going to be open, we planned all the theoretical classes during lockdown, so they have more free time for the clinics, for the student. So and I think that worked well. The thing I would also mention, what I think was Anu mentioned, that is the standardization of procedure. I think that is a real thing, because I remember having difficulties with that, with invited lecture. One of my subjects has a number of invited lecture, and they use different ways to put things. So even for me, it was difficult to find the videos that they upload or the material that they upload. So, but again, I think that was because of everything was new, everything was done in a rush. So probably that's something that has to be more standardized, and also everything was done by memo. You have to do this, you have to update, and there was not enough support, technical support for the transition. But I guess that was because of the rush of doing everything.
But Rodrigo, that's a lot about students. But what about your professors, your faculty? Did you have any reluctance in coming back?
No, not that I know. No, okay. That I know. Yeah.
All right. Good. Thank you. Darina, would you like to comment?
Yeah, for me, I come from the clinical environment, and I think it depended on the situation of each person. Like if say the staff member felt that they have health risks, they would be more reluctant to come back. But probably the younger generation who felt that they, would survive COVID if they got it, things like that. I think that they were more resilient and happy to come back. In Australia, every workplace had to come up with a COVID safety plan. You couldn't actually operate without one. And so, that was one way of making the team feel safe to return. And of course, that included taking temperatures, screening questions, but also I think actually now talking about patients, because I'm talking about clinical environment, I did notice there was some resistance from patients to come for their dental appointments. Initially, especially like last year, it was a problem, especially the elderly population. And so it did take quite a bit of reassurance, but then at the same time, you couldn't tell them they have to come, right? So it did end up meaning that, people weren't getting as much experience. A lot of rescheduling of appointments. Also, some people are stuck in other states and couldn't cross the border, for example. So yeah, back to my lecture from yesterday. It's all about communication and reassuring both the team and the patients of the safety measures that you're taking. And hopefully people will feel happy to come back.
Sure, definitely. Actually, it is interesting, at least for me, to hear that, because in our university, in Tec de Monterrey, at the beginning, our university was giving you the opportunity of coming back or staying online. And we still have a lot of faculty in other areas, like engineering or business, that they just don't want to come back. But we didn't find that same situation in the faculty in health sciences. For some reason, that's for me interesting, that we're probably more in the way of trying to help, or I don't know what's the explanation for this, because we all have families, we all have different activities and interests, but people just came back in health sciences, and it's not the same in some situations, but other areas in the same university. So that was why I was wondering about yourself.
That's a really interesting. Oh, sorry.
No, go ahead.
Really interesting observation, because I mean, the first thing that comes to mind is that perhaps because we are from the health industry, we have a better understanding, you know, a little bit better understanding about the body and about biology and how our bodies respond to diseases and viruses. So perhaps we understand risks a little bit more than, you know, someone in engineering or a completely different background. So, and I found that with patients, depending on their background, you know, some would be happy to come back, and then others kind of got very, very scared of COVID because maybe they didn't understand it very well as well.
Well, that's one thing. We understand better how the transmission works and how the protocols will help you, but also I'm wondering if we're also willing to take the risk also, because we know we're since always we're at more risk of the I don't know, hepatitis B or HIV,
or even dying. I think.
Yeah, that's our activity in our clinical activity. So I wonder if that also plays a role. Rodrigo, you were going to say something.
Yeah, no, I agree. I think and I would say that this is, look, I don't have the evidence for this. I think oral health professionals and students, they have a better understanding and knowledge about infection control than other professions. So probably that may reassure the student and the staff. And the other thing is that the university still recommends, don't go if you don't need to come. If you can do things from home, do it from home. So the recommendation is just come if you have to do something that requires your presence there. But if it doesn't, don't come.
And actually, something that I want to add about what Rodrigo just said is that among the professions, the health professions, we as dentists and the dental students, they were used to more familiar with the use of PPE than other health professions also. For example, the medical students or nutritionists or psychologists, they had to add the use of these barriers to their practice, while dentists and dental students, we already use it. So I think it would just, maybe that's part also of how the dental students, they accept easier the idea to came back to the clinic rather than other professions.
Yeah, that's definitely a good point. We're very used to use all these biological barriers, and not all other health professionals are used to that. So I don't know if there is another comment or question.
No, the other thing I want to also highlight is that, and that was done also was done in Mexico, was done in Chile, and also was done here, that the university provided students who did not have the resources. They provided them with laptops or tablets, and I don't know the name, but they seem to get access to internet. And that, I think that's important, because this is an assumption that we have, that all the students have in the past. The assumption was that everybody, all the students have access to computers, have a laptop, have access to internet. And this demonstrated that was not the case. There were a few students and also staff that didn't have those resources. So question our assumptions how things are.
Definitely. That's something we were just not thinking about, and seeing everybody's different resources, and we have like to equalize everything in order to keep going with the teaching and learning environment. So any other question, comment about this? I think we experienced a very useful session about how we, in extremely different parts of the world, share a lot of things in common, and we also learn from others. If there is no other comment, I think we can right now end this session regarding this adaptation to the pandemic situation in our schools. And I don't know if Rodrigo, if you want to go ahead with the session of dentistry, the discipline group.
Yeah, thank you very much, and thank Jorge to share the presentation and the session and the Q&A component. What I would like to do is try to put together all the presentation and write, a report of what was discussed and presented here. But I put this as a goal, not as a. I will not put time frame for this. Okay. But that's something I think we should use this experience and put and write a document on this. I think would be good. Look, the other thing that continuing with the session for the group, we need to start thinking of what we would like to do in the next session, in the next year, next meeting. 12 months seems far away, but it is not. I mean, times fly. I think in pandemic, in lockdown, time go faster than usual. I don't know why, but days go pretty fast, even though you think this is endless, goes fast. So we will see each other that we have to or face in the next meeting. So would be good if we start thinking of what we could do in 2022. I don't know exactly the date, but usually it's August or September. So it would be about the same time that we have to do, and that we will have the next meeting. So we have a few months to start planning. But during that time, there are other things that are happening. There are some opportunities for research. There are some awards for in teaching and excellence award that we can apply. So I encourage you to come forward with ideas and putting things together. As I mentioned, for those who are new here, U21 is not a funding body, but there is some money for research. There is some money for international projects. It's not a lot of money. It's enough for do some small projects, but the advantage is that it's less competitive than if you go for external sources. So let's try to put our heads together and use those opportunities for us. The other thing that I think also was Jorge that mentioned in one of our meetings the possibility of exchanging resources, teaching material. And there is a web page or a site in U21 where there are some courses that members of the network can participate. And I think the Tecnológico and the Catholic University in Chile, they have some courses there, which is good. There is nothing in dentistry, but we could see what within the legislation or possibility that we have to share some courses. So that's again is another opportunity that we can have more visibility of the group within the network. This is a very small group, so we need to make effort to make it more visible. Well, it's small compared to others, so we have to make an effort to make it visible. So that's something that we can think of and as permissions and clearance to put things together. The other thing, one example of that is the course in telehealth that we are almost finishing now, and that's the idea is to have that as a resource for the network. It was funded by the network, so will be available for everybody, students and staff for that. So stay tuned. Will come soon, and that's something an example of things that we can do. But think about I mean, ideas or courses or even requests of courses and see what we can do. I mean I know there are some limitations that for IPs and other another guideline I had to follow, but I think there are possibilities that we put things there. So
Rodrigo,
yeah, that's.
I think one of the things that did work very well was what Católica de Chile was doing with these lectures that invited
webinars.
us to participate, the webinars. I think this is something now we all are very used to share through Zoom. And I think this is a way of a very easy way to collaborate among our universities. Of course, the time zone barrier is always a problem, but we could see and work from that point of view and see what we can share in different topics. And I think that's a very easy way of collaboration.
Yeah, we can. Well, I mean, I can talk with the people at the Catholic University to see if they want to take the lead on that. But I mean, the recommendation was that to have one every 2 months, so wouldn't be a very high load. So you have to get up early once every 2 months. I think that's all right. I can do that. So yeah, no, that's a good idea. Again, let's try to put forward topics of things that we can. Actually, a good thing could be maybe an expansion of what we did today. I mean, to do something more structured and use this experience to prepare or propose another one. So yeah, that's a very good idea.
We can start inviting Darina with her topic in this. I think that's a very, very important and not very commonly approach topic that we could share in this group. Of course, we did have this session, but I'm talking about the rest of our faculty in our schools and of course our students. This is a topic of interest for our students, like Darina was saying yesterday, that are probably in the last third of their program. I think this is an interesting one.
Yeah. Yeah, no, it's a good area, it's a good topic, and I think will be a lot of interest from students. I think one of the limitations. Well, this session was not advertised as a webinar. The webinar were very broadly advertised, so if we can organize something, that would be good. And the other thing is that I know that with Zoom you can do immediate translation, so that would take the language barrier from a student from Mexico and Chile, or I don't know, well, Hong Kong maybe, or and Korea. But I know that the Zoom has that facility, but I don't think it's free. So I will explore that to see how we can get instance interpreting or translation. That I think that could facilitate the expansion of that, because I think language may be a limitation for that. So I will explore that.
All right.
So is there any other comment or topic or idea that anyone would like to put forward?
I don't. I just want to thank to everybody to join and for this extra effort of recording their sessions. I think, as I already said, it's a very interesting topic that we could learn from